Good morning, friends. Welcome to our next learning session. Today I am going to talk about heart failure, a very common condition, and you have heard of it. You have frequently heard people saying that such and such person died because of heart failure. But that is not medically speaking heart failure. That is called heart has stopped, that is cardiac arrest. The condition when person dies because of the stoppage of the beating of the heart, that is called cardiac arrest. That we are not talking of. That is not heart failure for medical professional. Then what is heart failure? You should understand. Then for knowing what is heart failure, we should know the function of the heart. The function of the heart is to push blood to the various organs and tissues of the body. The heart, after all, what does this blood do? This blood takes nutrients from the various sources and then supplies them to the tissues and organs. For this purpose, it requires oxygen. That also comes through the blood. Though in short, I will tell you that the blood reaches the heart, the upper chambers, that is the atria, from there to the ventricle, from the ventricle to the lungs, where it gives off the carbon dioxide and takes in oxygen, and this oxygenated blood, which we call purified blood, oxygenated blood is called purified blood, is brought back to the left side of the heart by four channels called four pulmonary veins, and then from the left atrium to the left ventricle, which is the pumping chamber, main pumping chamber, which pushes the blood out of the heart through aorta to reach various organs and tissues. This blood contains nutrients like glucose, amino acids and fatty acids, which when burnt in the presence of oxygen produce energy, and this energy is stored as chemical energy in the body in the form of a chemical compound called ATP. ATP stands for adenosine triphosphate. A for apple, T for train and P for public. ATP is a compound which is in which energy is present. So whenever you need energy, a unit of ATP is brought there and one phosphate bond is removed from it and energy is liberated. If more energy is required, one more phosphate bond is broken and energy is supplied. When there is extra energy that is given to this compound to make the ATP which we have utilized. I will not tell you detail because it is like something like this. You may not pay much attention to what I am going to say now. There is a compound called adenosine. Adenosine, when combined with one phosphate, is called adenosine monophosphate or AMP. And when there are two phosphate groups, it is called adenosine diphosphate, ADP. And when there are three phosphate groups, it becomes ATP, that is adenosine triphosphate. So in the body, the energy is stored as adenosine triphosphate, ATP. One unit of energy is removed and then it becomes ATP. When one more unit is removed, it becomes AMP. And now more energy cannot be removed. But when there is surplus energy, that combines with AMP to form ADP, and more energy comes there, it becomes ATP. So this is just to tell you about the energy mechanism. The basic function of the heart is to push the oxygenated blood rich in nutrients to the various organs, cells and tissues of the body, where these are burnt, that is metabolized, where they are burnt in the presence of oxygen to produce energy, and this is utilized by the body. So body has ready-made energy as well as stored energy for any emergency used. So what can cause heart failure? But before that, I want to show you this diagram. Look at this diagram. You might have seen it before also. See, this is the healthy heart, this side is healthy heart, and this is the heart failure patient, heart from a heart failure patient. See, this is smaller in size, this is bigger in size. Now see the various organs I have marked here. I am keeping it here. You can stop the video here and later on read these things. This is the right ventricle and this is the left ventricle. And what is this? This is the right atrium, and here there is the left atrium. And you see this, the top structure, blue structure, this is the superior vena cava, that is bringing blood back from the head and neck and upper part of the chest. And this blue structure is the pulmonary artery. This is the pulmonary artery. What is the function of the pulmonary artery? It takes blood from the right ventricle to the lungs for purification. The purified blood from the lungs comes back to the left atrium. Here, this is the left atrium. Left atrium by 4 channels. You see 2 channels here on the left side and 2 channels on the right side. These are called right and left pulmonary veins. Remember, these are bringing blood to the back to the heart, but these are called veins. So, friends, what causes the heart to fail? That means what causes the heart to not push sufficient blood according to the need of the body. In the beginning, you see, the patient may be able to function normally with heart failure, but when he does mild household chores, he becomes breathless. A normal person should be able to climb 10 to 12 stairs without becoming breathless. But if you cannot do that, then you are short of breath and you have to rush to the doctor to get treatment, because this may be heart failure. The why there is shortness of breath? Because the congestion in the lungs is not letting lungs to oxygenate blood properly. So details I will not tell you, because this becomes more of complexity and it is difficult to comprehend. The why heart fails is the high blood pressure, heart attack causing damage to the heart muscle, some birth defects, and primary disease of the heart muscle. All these can cause heart failure. Certain diseases of the lungs lead to heart failure. This condition is called cor pulmonale. There are to see many causes of heart failure, and we are not going to discuss all these here today. The important feature of heart failure, how you recognize, is the shortness of breath, which may be during exertion, at rest, or during lying down position, or even during the night. And the other important feature of heart failure is the cough and wheezing. Cough is really irritating. It is called nagging cough. It's irritating cough, and with narrowing of the air passages due to congestion, the whistling sound is produced. This is called wheezing. You have frequently seen patients with bronchial asthma, and when they breathe, they produce some whistles. Or some snoring sounds. As the person is sleeping and the tongue falls back, the person is snoring. That type of sounds are produced in cases of heart failure. The very important feature of heart failure is the swelling over the body. This swelling occurs over the dependent parts to begin with, like feet, around the ankles, legs, thigh, and ultimately it may involve even the belly and the coverings of the lungs. This can be very extensive, and the weight of the patient may increase because of this retention of water. Now you see here a diagram. What do I mean by swelling? See, this is pressure is being, when there is swelling, you apply pressure with your finger or thumb and keep it for 10 to 20 seconds. Keep the pressure for 10 to 20 seconds, and then remove the finger, and the result is this depression there. This is pit. That is why it is called pitting edema. This has produced a pit here, you see. And why it has produced it? Because this finger was pressing here and water has been ejected from this skin. When you remove your finger, it takes time for the water to come back here, and this pit remains like here shown in this diagram. So this is what is called pitting edema, very important sign of heart failure. Then patient may have fatigue. Why he should have fatigue? Because the blood from the muscles goes to the heart, brain and kidney, which are the vital organs, and blood, if this is not sufficient, blood from your digestive tract, that is the organs concerned with digestion, that also can be shunted to these areas. But by and large, your muscles are getting less blood, therefore they get tired easily and you feel fatigued. Then these patients also have a feeling of fullness. Their appetite is decreased because all the veins in the digestive tract, that is stomach, intestines, large intestines, the veins are full with blood and the patient has a feeling of fullness. Sometimes it is so marked that patient feels nauseated and he may even vomit. The less blood is going to the kidney, therefore kidney filters less sodium, and the retention of sodium leads to retention of water, as well as sodium can cause confusion. The last but important feature of heart failure is the increased heart beat. The number of beats increases. We can say racing heart, or medically we call it tachycardia. The tachy word is used for fast. Bradycardia, brady means slow and tachy means fast. When there is heart rate is fast, we say it is tachycardia, and patient comes with we say patient has got a racing heart, or patient may say, sir, my heart is racing, or it is beating very fast. So this is important sign. As I said in the beginning, it may be a compensatory mechanism in the beginning, but later on it becomes established feature. So in a established heart failure patient, you will have fast heart rate, you will have enlarged heart, you will have a forceful beat, and you will have cough, nagging cough, wheezing, and fatigue, confusion, swelling over the feet, or what we call pedal edema, nausea, and loss of appetite. These are the most important features of the heart, and that is when you should rush to the doctor to get yourself examined and get proper treatment. So friends, thank you very much for listening to it. We will take another topic next time. You continue with your effort of subscribing the channel as well as commenting on it, so that I know how many of you are being benefited. Thank you very much. We will meet next time.